Welcome to This Week in Medicine, your filtered medical journal summary. Looking to stay up to date with the latest medical research but short on time? This Week in Medicine has you covered. Our AI-generated podcast provides you with a convenient, on-the-go solution to keep you informed about the most significant developments in the medicine field. Each episode offers a filtered and concentrated summary of key journal articles, allowing you to stay informed without the need to sift through pages of research papers. With This Week in Medicine, listening is faster than reading, and you can consume valuable medical knowledge while commuting, exercising, or during your daily routine.
Hi, This Week in Medicine, we will be discussing. First, we will be discussing articles in New England Journal of Medicine. Transcatheter aortic valve replacement for asymptomatic severe aortic stenosis. Background. For patients with asymptomatic severe aortic stenosis and preserved left ventricular ejection fraction, current guidelines recommend routine clinical surveillance every 6 to 12 months. Data from randomized trials examining whether early intervention with transcatheter aortic valve replacement, TAVR, will improve outcomes in these patients are lacking. Among patients with asymptomatic severe aortic stenosis, a strategy of early TAVR was superior to clinical surveillance in reducing the incidence of death, stroke, or unplanned hospitalization for cardiovascular causes. APOL1 bi- and monoallelic variants and chronic kidney disease in West Africans. Background. Apolipoprotein L1 gene, APOL1, variants, are risk factors for chronic kidney disease, CKD, among Black Americans. Data are sparse on the genetic epidemiology of CKD and the clinical association of APOL1 variants with CKD in West Africans, a major group in the Black population Tenecteplase occlusions. In this study, monoallelic APOL1 variants were associated with 18% higher odds of CKD and 61% higher odds of focal segmental glomerulosclerosis. Biallelic APOL1 variants were associated with 25% higher odds of CKD and 84% higher odds of focal segmental glomerulosclerosis. Fracture prevention with infrequent Zoledronate in women 50 to 60 years of age. Background. Zoledronate prevents fractures in older women when administered every 12 to 18 months, but its effects on bone density and bone turnover persist beyond 5 years. Whether infrequent Zoledronate administration would prevent vertebral fractures in early postmenopausal women is unknown. Conclusions. 10 years after trial initiation, Zoledronate administered at baseline and 5 years was effective in preventing morphometric vertebral fracture in early postmenopausal women. Survival with Trastuzumab Emtansine in residual HER2-positive breast cancer. Background. Patients with human epidermal growth factor receptor 2, HER2-positive early breast cancer with residual invasive disease after neoadjuvant systemic therapy have a high risk of recurrence and death. The primary analysis of Catherine, a Phase 3, open-label trial, showed that the risk of invasive breast cancer or death was 50% lower with adjuvant Trastuzumab Emtansine (TDM1) than with Trastuzumab alone. See conclusions. As compared with Trastuzumab, TDM1 improved overall survival with sustained improvement in invasive disease-free survival among patients with HER2-positive early breast cancer with residual invasive disease after neoadjuvant therapy. Next, we will be discussing articles from Journal of American Medical Association. Intra-Arterial Tenecteplase following endovascular reperfusion for large vessel occlusion, acute ischemic stroke. The POST-TNK randomized clinical trial. Question: does adjunctive intra-arterial tenecteplase, following near complete to complete reperfusion by endovascular thrombectomy, improve freedom from disability in patients with large vessel occlusion, acute ischemic stroke? Findings in this randomized clinical trial that included 540 patients. Treatment with intra-arterial tenecteplase after endovascular thrombectomy resulted in freedom from disability, a modified Rankin scale score of 0 or 1, at 90 days in 49.1% of patients compared with 44.1% of patients not treated with intra-arterial thrombolysis. This difference was not statistically significant. Adjusted risk ratio, 1.15. meaning among patients with large vessel occlusion stroke presenting within 24 hours of time last known to be well, and who had achieved near complete to complete reperfusions. After endovascular thrombectomy, adjunctive intra-arterial tenecteplase did not significantly increase the likelihood of freedom from disability. Intra-arterial urokinase after endovascular reperfusion for acute ischemic stroke. The POST-TNK randomized clinical trial. Question among patients with acute ischemic stroke caused by large vessel occlusion within 24 hours. Does intra-arterial thrombolysis by urokinase administered after near complete to complete reperfusion by endovascular thrombectomy improve clinical outcomes? Findings. In this randomized clinical trial that included 534 patients, the percentage of patients who survived without disability, measured by a modified Rankin scale score of 0 or 1, at 90 days was 45.1% in the intra-arterial urokinase group and 40.2% in the control group that did not receive intra-arterial thrombolysis. This resulted in an adjusted risk ratio of 1.13, a difference that was not statistically significant, meaning adjunctive intra-arterial urokinase to endovascular thrombectomy for acute ischemic stroke did not significantly improve the percentage of patients who survived without disability. Next, we will be discussing articles from Annals of Internal Medicine. Inequities in distance to lung cancer screening programs. Background. The U.S. Preventive Services Task Force recommends annual lung cancer screening, LCS, for adults who meet specific age and smoking history criteria. Results. Geometric mean distance to the nearest LCS facility was 6.5 miles. Compared with NHW majority census tracts, distance to the nearest LCS facility was 5.26 times, 426%, longer in AI/in majority census tracts and 7% to 39% shorter in Asian, Black, and Hispanic majority census tracts. Adjustment for rurality reduced the mean distance in AI/in majority census tracts, but the mean distance was still 3.16 times the distance in NHW majority census tracts. Adjustment for rurality reduced the observed advantage in Asian and Black majority census tracts, and changed the direction of associations in Hispanic majority census tracts. Conclusion. Differences exist in distance to LCS facilities by race and ethnicity, that can only be partially explained by rurality. Next, we will be discussing articles from British Medical Journal. Time to nursing home admission and death in people with dementia. Objective to summarize available evidence on time to nursing home admission and death among people with dementia, and to explore prognostic indicators. Conclusions. The average life expectancy of people with dementia at time of diagnosis ranged from 5.7 years at age 65 to 2.2 at age 85 in men, and from 8.0 to 4.5, respectively, in women. About one-third of remaining life expectancy was lived in nursing homes, with more than half of people moving to a nursing home within 5 years after a dementia diagnosis. Prognosis after a dementia diagnosis is highly dependent on personal and clinical characteristics, offering potential for individualized prognostic information and care planning. Next, we will be discussing articles from Lancet. Efficacy, safety, and target engagement of dizukibart, an IFN beta-specific monoclonal antibody, in adults with dermatomyositis, a multi-center, double-blind, randomized, placebo-controlled, phase 2 trial. Background. Dermatomyositis is a chronic autoimmune disease with distinctive cutaneous eruptions and muscle weakness, and the pathophysiology is characterized by type I interferon, IFN, dysregulation. This study aims to assess the efficacy, safety, and target engagement of dizukibart, a potent, selective, humanized Ig-1 neutralizing monoclonal antibody directed against IFN beta, in adults with moderate to severe dermatomyositis. Interpretation. Dizukibart resulted in a pronounced reduction in disease activity and was generally well tolerated, supporting IFN beta inhibition as a highly promising therapeutic strategy in adults with dermatomyositis. Next, we will be discussing articles in the field of hemato-oncology. Here are the articles from Journal of Clinical Oncology. Association of Participation in Medicare's Oncology Care Model with Spending, Utilization, and Quality Outcomes among Commercially Insured and Medicare Advantage members. Purpose: the Oncology Care Model, OCM, a value-based payment model for traditional Medicare beneficiaries with cancer, yielded total spending reductions that were outweighed by incentive payments, resulting in net losses to the Centers for Medicare and Medicaid Services. We studied whether the OCM yielded spillover effects in total episode spending, utilization, and quality among commercially insured and Medicare Advantage (MA) members who were not targeted by the program's conclusion. The OCM was associated with reductions in spending for non-targeted members, a spillover effect. Here are the articles from Journal of Hepatology. Effect of pemvidutide, a GLP-1/glucagon dual receptor agonist, on MOSLD, a randomized, double-blind, placebo-controlled study. Pemvidutide is a GLP-1/glucagon dual receptor agonist. Pemvidutide treatment significantly reduced liver fat content compared to placebo. Pemvidutide treatment significantly reduced non-invasive biomarkers of liver inflammation. Pemvidutide treatment significantly reduced body weight. Pemvidutide may be an effective treatment for MASH. Neuropilin-1 is a novel host factor modulating the entry of hepatitis B virus. Single-cell sequencing and susceptibility analysis identify host factors involved in the process of HBV infection. NRP1 enhances viral attachment and internalization, and promotes viral infection in the presence of NTCP. NRP1 modulates HBV infection by interacting with HBV prey1 and NTCP. NRP1 antagonist EG00229 treatment pre-inoculation inhibits HBV infection in cell model and human liver chimeric mice. Next, we will be discussing articles in the field of gastroenterology. Here are the articles from Gastroenterology. Unveiling cancer-related metaplastic cells in both Helicobacter pylori infection and autoimmune gastritis. Background and aims. Gastric metaplasia may arise as a consequence of chronic inflammation, and is associated with an increased risk of gastric cancer development. Although Helicobacter pylori, HP, infection and autoimmune gastritis, AIG, both induce gastric metaplasia, possible distinctions in resulting metaplastic cells and their respective cancer risks requires further investigation to conclusion. Both HP infection and AIG trigger a diverse array of metaplastic cell types. Identification of a cancer-related metaplastic cell uniquely expressing ANPEP CD13, present in both HP and AIG-induced gastritis, indicates the carcinogenic capacity of both diseases. This discovery can guide early detection and risk stratification for patients with chronic gastritis. Here are the articles from Clinical Gastroenterology. Satisfaction with and adherence to off-label corticosteroids in adolescents and adults with eosinophilic esophagitis. Results of a web-based survey in the United States. Goals. We assessed satisfaction with and adherence to off-label corticosteroids in patients with eosinophilic esophagitis, O, in the United States. Background. O is a chronic inflammatory disease for which there are currently no U.S. Food and Drug Administration approved swallowed topical corticosteroids. Conclusions. Satisfaction with and adherence to off-label corticosteroids were low in this web-based survey of adolescents and adults with O in the United States. Meta-analysis of endoscopic full-thickness resection versus endoscopic submucosal dissection for complex colorectal lesions. Background. Studies evaluating endoscopic full-thickness resection, EFTR, and endoscopic submucosal dissection, ESD, for complex colorectal lesions have shown variable results. We conducted a meta-analysis of the available data discussion. This meta-analysis of small studies with high heterogeneity showed that EFTR and ESD have comparable resection rates for complex colorectal lesions. EFTR is faster and has fewer complications, but it increases residual or recurrent lesions. Next, we will be discussing articles in the field of rheumatology. Altered protein structures and neoepitopes in lupus neutrophils, from dysregulated splicing of messenger RNA objective. To test whether messenger RNA, mRNA, splicing is altered in neutrophils from patients with systemic lupus erythematosus, SLE, and can produce neoantigens. Conclusion. We conclude that aberrant mRNA splicing in SLE has the potential to affect both the function of granulocytes and to generate novel autoantigens. Here are the articles from Journal of Clinical Rheumatology. Nationwide analysis of variables associated with sarcoid in patient mortality. Background. Sarcoidosis is a multi-system autoimmune disease that can result in significant morbidity and mortality. This study aims to identify factors associated with in-hospital death for sarcoid patients on a national level. Conclusions. Our multi-year national analysis showed that 2.5% of hospital admissions with a sarcoid diagnosis ended in death. The following factors were associated with death: age, Charlson Comorbidity Index, male sex, other race, arrhythmia/heart blocks, cirrhosis/hepatic failure, hemophagocytic lymphohistiocytosis, infection, interstitial lung disease, heart failure/myocarditis, neurologic diseases, and pulmonary hypertension. This information can help clinicians by improving awareness of these life-threatening complications, because early recognition and intervention may improve inpatient sarcoid outcomes. Next, we will be discussing articles in the field of cardiology. Here are the articles from Circulation. Sickle, trait and alpha thalassemia increase NOS-dependent vasodilation of human arteries through disruption of endothelial hemoglobin-eNOS interactions. Background. Severe malaria is associated with impaired nitric oxide, NO, synthase, NOS-dependent vasodilation, and reversal of this deficit improves survival in murine models. Malaria might have selected for genetic polymorphisms that increase endothelial NO signaling and now contribute to heterogeneity in vascular function among humans. One protein potentially selected for is alpha-globin, which, in mouse models, interacts with endothelial NOS, to negatively regulate NO signaling. Wheelies, wheeze, we, ul, we, or sought to evaluate the impact of alpha-globin gene deletions on NO signaling and unexpectedly found human arteries use not only alpha but also beta-globin to regulate NOS. Conclusions. Alpha and beta-globin subunits of hemoglobin interact with eNOS to restrict NO signaling in human resistance arteries. Malaria protective genetic variants that alter the expression of alpha-globin or the structure of beta-globin are associated with increased NOS-dependent vasodilation. Targeting the hemoglobin-eNOS interface could potentially improve NO signaling in diseases of endothelial dysfunction, such as severe malaria or chronic cardiovascular conditions. Here are the articles from Journals of the American College of Cardiology. Drug-coated balloon angioplasty of the side branch during provisional stenting, the multicenter randomized DCB-BIF trial. Background. Side branch stenting is often required during provisional stenting, leading to suboptimal results. Drug-coated balloons, DCB, for the compromised side branch have emerged as an attractive strategy. However, the benefit of DCB for coronary bifurcations remains unclear. Conclusions. In patients with simple and true coronary bifurcation lesions undergoing provisional stenting, main vessel stenting with a DCB for the compromised side branch resulted in a lower one-year rate of the composite outcome compared with an NCB intervention for the side branch. The high rates of periprocedural myocardial infarction, which occurred early and did not lead to revascularization, are of unclear clinical significance. From JAMA Cardiology. Aspirin and hemocompatibility after Levodopa implantation in patients with atherosclerotic vascular disease. A secondary analysis, From the ARES-HM3 Randomized Clinical Trial. Question: Do common conditions, prior percutaneous coronary intervention, PCI, coronary artery bypass grafting, CAG, stroke, or peripheral vascular disease, PVD, for which aspirin is indicated, influence outcomes differentially when aspirin is eliminated from the antithrombotic regimen in recipients of the HeartMate 3, HM3, Abbott cardiovascular, left ventricular assist device, LVAD? Findings. In this pre-specified analysis of the aspirin and hemocompatibility events with a left ventricular assist device in advanced heart failure, ARES-HM3, randomized clinical trial, the presence of an atherosclerotic vascular condition did not modify the observed benefit of aspirin avoidance on the primary outcome, survival-free of any non-surgical hemocompatibility-related adverse events, including stroke, pump thrombosis, bleeding, and arterial peripheral thromboembolism at 12 months, or secondary outcome of reduction in non-surgical bleeding, meaning prior PCI, stroke, PVD, or CAB should not compel physicians to use aspirin as part of the antithrombotic regimen with the HM3 levy. Next, we will be discussing articles in the field of endocrinology. Here are the articles from Journal of Clinical Endocrinology and Metabolism. Regional adiposity and insulin sensitivity, interactions with menopause and HIV in middle-aged Black African women. Objective: to explore depot-specific functional aspects of adipose tissue, examining the putative role for menopause and HIV status on insulin sensitivity, SI, and beta cell function in Black South African women. Conclusion: insulin sensitivity and beta cell function were distinctively associated with ASAT and GIASAT. While menopause did not influence these relationships, HIV had a significant effect on adipose tissue, characterized by variations in cell size distribution and transcript levels within the depots. Here are the articles from Diabetes Care. Combination SGLT2 inhibitor and glucagon receptor antagonist therapy in type 1 diabetes, a randomized clinical trial. Objective: to examine the effects of insulin adjunctive therapy with a sodium glucose cotransporter 2, SGLT2, inhibitor and a glucagon receptor antagonist, GRA, on glycemia, insulin use, and ketogenesis during insulinopenia in type 1 diabetes. See conclusions. Glucagon antagonism enhances the therapeutic effects of SGLT2 inhibition in type 1 diabetes. Combination therapy improves glycemic control, reduces insulin dosing, and suggests a strategy to unlock the benefits of SGLT2 inhibitors while mitigating the risk of diabetic ketoacidosis. Next, we will be discussing articles in the field of pulmonary and critical care. Here are the articles from CHEST. Clinical characteristics and prognosis of patients with severe pneumonia, with pneumocystis jirovecii colonization. Background. For decades, the incidence and clinical characteristics of pneumocystis jirovecii colonization in patients with severe pneumonia was unclear. Research question: what are the clinical features and outcomes associated with P. jirovecii colonization in individuals diagnosed with severe pneumonia? Interpretation. Immunosuppression and a reduced lymphocyte count were identified as risk factors for P. jirovecii colonization in patients with non-pneumocystis pneumonia. More frequent detection of various viruses was observed in patients colonized with P. jirovecii, and P. jirovecii colonization was associated with an increased 28-day mortality in patients with severe pneumonia. Here are the articles from the American Journal of Respiratory and Critical Care Medicine. Proteomic risk score of increased respiratory susceptibility, a multi-cohort study. Rationale: accelerated decline in lung function is associated with incident chronic obstructive pulmonary disease, COPD, hospitalization, and death. However, identifying this trajectory with longitudinal spirometry measurements is challenging in clinical practice. Objectives: to determine whether a proteomic risk score trained on accelerated decline in lung function can assess the risk of future respiratory disease and mortality. Conclusions: a proteomic signature of increased respiratory susceptibility identifies people at risk of respiratory death, incident COPD, and respiratory exacerbations. This susceptibility score is composed of proteins with well-known and novel associations with lung health and holds promise for the early detection of lung disease without requiring years of spirometry measurements. Next, we will be discussing articles in the field of nephrology. Here are the articles from Clinical Journal of American Society of Nephrology. Surrogate endpoints in apolipoprotein L1-associated kidney disease, evaluation in 3 cohorts. Apolipoprotein L1. APOL1, high-risk genotype, had higher risk of 3-year GFR-related surrogate endpoints and long-term kidney failure than those with the low-risk genotype. No consistent difference in surrogate clinical outcome associations by APOL1 genotype, supporting the use of surrogates in APOL1 kidney disease. Medication burden and adverse cardiovascular events and death in patients treated with maintenance hemodialysis, a nationwide cohort study. A higher medication burden was associated with a higher risk of adverse events in patients receiving maintenance hemodialysis. Medication burden can serve as a clinically relevant risk indicator for cardiovascular events and all-cause death in patients on maintenance hemodialysis. Here are the articles from Kidney International Reports. Outcome of patients transplanted for C3 glomerulopathy and primary immune complex-mediated membranoproliferative glomerulonephritis. Introduction. Approximately 50% of patients with C3 glomerulopathy, CEG, and primary immune complex-mediated membranoproliferative glomerulonephritis, IC-MPGN, reach kidney failure 10 years after diagnosis. Because these patients are generally young, the majority will be listed for kidney transplantation, KTX. However, reported outcomes in patients transplanted for SEG and IC-MPGN are heterogeneous and conflicting, because they are mainly based on retrospective monocentric studies. We thus aimed to provide detailed multicenter data on these patients, taking advantage of the ongoing nationwide Swiss transplant cohort study, STCS. Conclusion. This study provides important insights into the epidemiology and outcome of patients with SEG and IC-MPGN and their grafts after KTX. The data also suggest that proteinuria may serve as an early biomarker of disease recurrence and should be considered in patient management as well as an endpoint in current clinical trials using novel complement modulators.
Thank you for listening to This Week in Medicine, your filtered medical journal summary. Have a great week ahead, stay blessed and be humane.